When we think of pain, most of us imagine a sharp sting or a throbbing ache, but pain is much more than just a physical sensation. It's a complex experience that involves our bodies, minds, and even our emotions. From the moment you stub your toe to the lingering ache of a headache, pain signals travel through nerves up your spinal cord and into your brain. But what happens next is influenced by your thoughts, past experiences, and even your mood. In this video, we'll explore how pain is not just a simple response to injury, but a multifaceted phenomenon that shapes our lives in unexpected ways. Let's dive into the science behind pain. When your body is injured, special nerve endings called nociceptors detect damage and send signals to your brain. But pain isn't just about these signals. Your brain interprets them, deciding how intense the pain feels and how you should react. This means that two people with the same injury might experience pain very differently. Factors like stress, anxiety, and even your environment can change how your brain processes pain. Understanding this helps us see why pain is such a personal experience, shaped by both biology and psychology. Pain comes in many forms. There's acute pain like the sudden jolt from touching something hot, which usually fades as you heal. Then there's chronic pain, which lingers for months or even years, sometimes without a clear cause. Some pain is sharp and stabbing, while other pain is dull and aching. There's also neuropathic pain caused by nerve damage and referred pain, where you feel pain in a different part of your body than where the problem actually is. Each type of pain tells a different story about what's happening inside your body. Acute pain acts as a warning signal. It tells you to stop what you're doing and protect yourself from further harm. For example, if you sprain your ankle, the pain makes you rest and heal. Chronic pain, on the other hand, is more complicated. It can persist long after an injury is healed or even appear without any obvious cause. Chronic pain can be exhausting, affecting your mood, sleep, and overall quality of life. Understanding the difference between acute and chronic pain is key to finding the right treatment and support. Pain isn't just physical, it's deeply emotional. When you're in pain, you might feel frustrated, anxious, or even depressed. These emotions can actually make your pain feel worse. It's a two-way street. Pain affects your emotions, and your emotions affect your pain. This is why treating pain often involves more than just medication. Support from friends, therapy, and stress management can all help reduce the emotional burden of pain and make it easier to cope. Your brain plays a central role in how you experience pain. When pain signals reach the brain, they're processed in areas that also handle emotions, memories, and attention. This means that your thoughts and feelings can change how much pain you feel. For example, focusing on something enjoyable can make pain seem less intense, while stress or fear can make it worse. Understanding the brain's role in pain helps explain why pain is such a complex and personal experience. Do you know that culture can influence how we experience and express pain? In some cultures, people are encouraged to be stoic and hide their pain, while in others, it's normal to express discomfort openly. These cultural attitudes shape how we talk about pain, seek help, and even how we feel it. Understanding these differences can help doctors and caregivers provide better support and avoid misunderstandings when treating pain. Everyone has a different pain threshold, the point at which something starts to hurt. Genetics, past experiences, and even your mood can influence your pain threshold. Some people seem to tolerate pain easily while others are more sensitive. It's important to remember that pain is subjective and there's no right or wrong way to feel it. Respecting individual differences in pain perception is crucial for empathy and effective care. Our memories can shape how we experience pain. If you've had a painful experience in the past, your brain might be more sensitive to pain signals in the future. Sometimes just remembering a painful event can make you feel discomfort all over again. This connection between memory and pain shows how deeply our minds are involved in the pain experience, and why psychological support can be so helpful for people dealing with chronic pain. Stress and pain are closely linked. When you're stressed, your body releases chemicals that can make pain feel worse. Chronic stress can even lead to muscle tension and headaches. On the flip side, being in pain can increase your stress levels, creating a cycle that's hard to break. Learning to manage stress through relaxation techniques, exercise, or talking to someone can help reduce pain and improve your overall well-being. Pain can make it hard to get a good night's sleep. Tossing and turning, waking up frequently, or feeling uncomfortable can all disrupt your rest. Unfortunately, poor sleep can also make pain feel worse the next day. This creates a vicious cycle where pain and sleep problems feed into each other. Finding ways to improve sleep, like keeping a regular bedtime or creating a relaxing routine, can help break this cycle and make pain easier to manage. Children experience pain differently than adults. They might not always have the words to describe what they're feeling, so they show pain through behavior, like crying, withdrawing, or acting out. It's important for parents and caregivers to pay attention to these signs and offer comfort. Teaching children how to express their pain and reassuring them can help them feel safe and supported as they heal. Older adults often face unique challenges with pain. They may have multiple health conditions, making it harder to pinpoint the source of pain. Sometimes they might not want to talk about their pain, fearing they'll be a burden. It's important to listen carefully and encourage open communication. Managing pain in the elderly often requires a team approach, involving doctors, family, and caregivers working together. Research shows that men and women may experience pain differently. Hormones, genetics, and even social expectations can influence how pain is felt and expressed. For example, women are more likely to experience certain chronic pain conditions, while men might be less likely to talk about their pain. Recognizing these differences can help ensure everyone gets the care and understanding they need. Not all pain is visible. Conditions like migraines, fibromyalgia, or nerve pain might not show any outward signs, but they can be just as debilitating as visible injuries. People with invisible pain often struggle to get understanding and support from others. It's important to believe and support those who say they're in pain, even if you can't see it. Living with pain can affect your relationships. You might feel isolated or misunderstood, and loved ones may not always know how to help. Open communication is essential. Sharing your feelings and needs can help others understand what you're going through. Support from friends and family can make a big difference in coping with pain and maintaining strong, healthy relationships. Pain can make it difficult to work or focus on tasks. You might need to take breaks, adjust your workspace, or ask for accommodations. Employers and coworkers who understand the challenges of pain can help create a supportive environment. Being open about your needs and seeking help when necessary can make it easier to manage pain while staying productive. Managing pain often requires a combination of approaches. Medication can help, but it's not the only answer. Physical therapy, exercise, relaxation techniques, and counseling can all play a role. Finding the right mix of treatments is a personal journey, and what works for one person might not work for another. The goal is to reduce pain and improve quality of life, not just mask the symptoms. There are many types of medications for pain, from over-the-counter painkillers to prescription drugs. Each type works differently and has its own risks and benefits. It's important to use medications as directed and talk to your doctor about any concerns. Sometimes medications are combined with other treatments for the best results. Always be open with your healthcare provider about what's working and what's not. Physical therapy can be a powerful tool for managing pain. Therapists use exercises, stretches, and hands-on techniques to help reduce pain and improve movement. They also teach you how to move safely and avoid further injury. Physical therapy is often part of a long-term plan for people with chronic pain, helping them regain strength and confidence. Mind-body techniques like meditation, deep breathing, and yoga can help manage pain by calming the nervous system and reducing stress. These practices teach you to focus your attention, relax your muscles, and change how you respond to pain. Over time, mind-body techniques can make pain feel less overwhelming and improve your sense of control. Regular exercise can help reduce pain, especially for chronic conditions like arthritis or back pain. Movement keeps your joints flexible, strengthens muscles, and releases endorphins, your body's natural painkillers. It's important to choose activities that are safe and enjoyable for you. Even gentle exercise like walking or swimming can make a big difference over time. Cognitive behavioral therapy, or CBT, is a type of counseling that helps you change negative thoughts and behaviors related to pain. By learning new ways to cope, you can reduce the emotional impact of pain and feel more in control. CBT is often used for chronic pain and can be combined with other treatments for the best results. Many people find relief from pain through alternative therapies like acupuncture, massage, or herbal remedies. While not all alternative treatments are backed by strong scientific evidence, some people find them helpful as part of a broader pain management plan. Always talk to your healthcare provider before trying new therapies to make sure they're safe for you. The placebo effect is a fascinating part of pain management. Sometimes, just believing that a treatment will help can actually make you feel better, even if the treatment has no active ingredients. This shows how powerful the mind can be in shaping our experience of pain. Researchers are still learning how to harness the placebo effect to improve pain care. What you eat can influence how you feel pain. A balanced diet rich in fruits, vegetables, and whole grains can help reduce inflammation and support healing. Some foods, like those high in sugar or processed fats, might make pain worse for some people. Staying hydrated and eating well can be a simple but powerful way to support your body as it manages pain. Technology is changing the way we manage pain. From wearable devices that track symptoms to apps that guide relaxation exercises, new tools are making it easier to monitor and treat pain. Telemedicine allows people to connect with pain specialists from home, expanding access to care. As technology advances, it offers hope for better pain management in the future. Some people use creative activities like art, music, or writing to cope with pain. Expressing yourself through creativity can be a powerful way to process emotions and distract from discomfort. These activities can also help you connect with others and find meaning, even during difficult times. Creativity doesn't take away pain, but it can make it easier to live with. Mindfulness is the practice of paying attention to the present moment without judgment. For people with pain, mindfulness can help by reducing stress and changing how you relate to discomfort. Mindfulness techniques like body scans or mindful breathing can make pain feel less overwhelming and improve your overall well-being. Sometimes fighting pain can make it feel worse. Acceptance doesn't mean giving up, it means acknowledging your pain and finding ways to live a full life despite it. Acceptance and commitment therapy (ACT) is one approach that helps people focus on what matters most to them, even when pain is present. This shift in perspective can make pain feel less controlling. Hope is a powerful force in coping with pain. Believing that things can improve even if pain doesn't go away completely can make a big difference in how you feel. Support from others, setting goals, and celebrating small victories all help build hope. Remember, you're not alone in your journey with pain, and there are always new ways to find relief and meaning. Resilience is the ability to bounce back from challenges, including pain. Building resilience involves learning new coping skills, staying connected to others, and taking care of your body and mind. Over time, resilience can help you adapt to pain and find ways to thrive, even when life is difficult. Having a strong support network can make a big difference in managing pain. Friends, family, support groups, and healthcare providers can all offer understanding, encouragement, and practical help. Reaching out for support isn't a sign of weakness, it's a smart way to take care of yourself and find new strategies for coping. Advocating for yourself is important when dealing with pain. This means speaking up about your needs, asking questions, and making informed decisions about your care. Advocacy can also mean raising awareness about pain conditions and supporting others who are struggling. Together, we can work toward better understanding and treatment for everyone living with pain. Unfortunately, there's still a lot of stigma around pain, especially when it's invisible or chronic. People may be judged or misunderstood, which can add to their suffering. Challenging stigma means educating others, sharing your story, and supporting those who are struggling. Compassion and understanding go a long way in breaking down barriers. Future of pain management is full of promise. Advances in medicine, technology, and our understanding of the mind-body connection are opening up new possibilities for relief. Researchers are working on better treatments, personalized care, and innovative therapies. While pain may always be a part of life, the future holds hope for more effective and compassionate care. Practicing gratitude can help shift your focus from pain to the positive aspects of life. Even small moments of joy or comfort can make a difference. Keeping a gratitude journal or sharing thanks with others can help build resilience and improve your mood, making pain feel less overwhelming. Finding purpose, even in the midst of pain, can give life meaning and direction. Whether it's helping others, pursuing a passion, or simply making it through each day, having a sense of purpose can make pain easier to bear. Purpose doesn't erase pain, but it can help you move forward with hope and determination. Compassion for yourself and others is essential when dealing with pain. Being kind to yourself, accepting your limits, and reaching out for help are all acts of compassion. Supporting others who are in pain can also bring comfort and connection. Compassion creates a sense of community and helps everyone feel less alone. Pain can be a catalyst for personal growth. Facing challenges, learning new skills, and adapting to change can all help you grow stronger and more resilient. While no one chooses pain, many people find that they discover new strengths and insights through their experiences. Growth doesn't mean the pain disappears, but it can make life richer and more meaningful. Taking care of yourself is crucial when living with pain. This means listening to your body, resting when you need to, and doing things that bring you comfort and joy. Self-care isn't selfish, it's a necessary part of managing pain and maintaining your well-being. Small acts of self-kindness can make a big difference. Talking about pain can be difficult, but clear communication is key to getting the help you need. Describe your pain as accurately as possible, including where it is, how it feels, and what makes it better or worse. Good communication helps doctors, family, and friends understand your experience and provide better support. Empathy is the ability to understand and share the feelings of others. When someone is in pain, showing empathy can make them feel seen and supported. Listening without judgment, offering comfort, and being patient are all ways to show empathy. This helps build trust and makes the journey with pain a little easier. Adapting to pain means finding new ways to do things and adjusting your expectations. This might involve using assistive devices, changing routines, or asking for help. Adaptation is a sign of strength, not weakness. It allows you to keep living your life and doing the things that matter most, even when pain is present. Pain is far more than just a physical sensation. It touches every part of our lives, body, mind, and spirit. By understanding pain's many faces, we can find new ways to cope, connect, and thrive. Whether you're living with pain or supporting someone who is, remember that compassion, understanding, and hope are powerful tools. Together, we can face pain with strength and resilience.